Hello, I hope you guys are having a great day. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We're going to go through some self-treatment exercises to get that mid and upper back pain resolved. It's very common as we sit more and more, we sit at our desks, we're looking at our phones, we have this mid back pain, we have this upper back pain, and it's hard to show you, but it's right about here, kind of in between those shoulder blades, not all the way up into the neck, although it could go up into the neck. I'm not going to show you neck treatments today, but really just this, not the low back, not the neck, but pretty much everything in between is where we're going to show you how to do some self-treatments. And the thing about doing these self-treatments at home is, first of all, you should always consult a medical professional before you ever do anything on your own, but you can do these often enough that they can make a difference. And even if you aren't experiencing any pain, these are good habits to get into in order to keep your back healthy. Unfortunately, the longer we sit, the more unhealthy we become. We make our joints less fluid, we make our muscles less pliable, and this all leads to increased arthritic changes and increased pain. So it's important that as you sit, and we all do it, you do some of these even before you have pain. And these can be a maintenance program, these can be a treatment, but I'm gonna show you 3 things that you can do at home that will help alleviate some of that mid-back pain. So the first one I'm gonna show you is with a towel. So you wanna take a towel, and it basically just needs to be able to reach around you. So kind of like going to whip somebody in the locker room with your towel, you wanna wind it up a little bit. This is just to kind of get on top of the vertebrae in your back. For this one, what you can do is you're gonna take both sides of it. You wanna kind of get on that pain point, or if you don't have a pain point, you can just do this for maintenance, and you just wanna arch your back up and pull forward. And then you can shimmy it up, and you can arch and pull forward. The idea is that you're just applying some pressure to that spine, to that rib cage, as you extend backwards. Now you can also work on some rotation with this. So let's say it hurts when you turn to the left. What you can do is you can turn to the left and then hold this right arm still and then pull on the left. And that's gonna give you a little bit more oomph on that left-hand side. Same thing if you're having trouble turning to the other side. You wanna hold the side, you wanna hold this still, and then you're gonna pull on that right arm, helping that rotation to that side. The idea is though that you hold this arm steady, you hold the towel steady, and then you rotate this way. You're gonna feel your ribs kind of spring. You can even get a pop or two, and you can just kind of go right up the rib cage. Once you get up to where your shoulder blade is, this gets a little bit trickier to do, only because your shoulder blades are gonna be in the way, but this is a really great technique that you can do. You can keep this towel on your desk, on the back of your chair, and then you can just kind of go through and move all of your vertebrae. Second technique I'm going to show you is on a foam roller. So I'm going to use one that is spike. This one is called a rumble roller. I will put a link to which one this is in the actual description, but what this is going to do is alleviate some of that pain. Now, if you have a flat foam roller, this works fine too. You don't have to necessarily have a rumble roller. But what you're going to do is you're just gonna lay on it, and you just wanna roll back and forth, okay? Or you can just lay back, okay? Now, if you're just gonna lay back, you wanna kinda inch up and inch down. Since you're not really rolling over the muscles, you're doing more work to the vertebrae. If you wanna make this more intense, you can lift your arms up and overhead, okay? That'll make it a little more intense. I recommend starting here if you're gonna do just kind of the movement over the foam roller. I recommend you just start with your arms here, or you can then roll out all the way up. Don't go onto your neck. Just kind of keep it here, nice and easy. You wanna do that just for a couple minutes to help loosen up those muscles in the back. And the last one I'm gonna show you is with what we call a beastie ball. It's a smaller version of a foam roller. You can use a tennis ball, you can use a golf ball, but this, something with spikes in it, really gets in there. Now this is a little bit more aggressive. This will actually target really sore points on your back, so you want to be careful. You may not be able to tolerate this laying down and putting all your body weight on this. So if you want, you can put this in a pillowcase and throw it over your shoulder. But what you want to do is you want to target, kind of find a specific area that hurts, and maybe you aren't even sure, but you can just start, again, rolling around on this, okay? Finding a little bit of those spots that are sore, and you can stay on them. Just stay on them for a few seconds, because you can really irritate the muscle and cause it to hurt a lot worse. So you don't want to needle it to death, and because this is a little bit more aggressive, you want to back off and not go as strong. So you don't want to spend 5 minutes with this guy on a particular spot, but moving it around and loosening up some of that vertebrae, some of those muscles, some of those joints can really help. If you or someone you know is suffering with upper and mid back pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good day.